Hi, and thank you for joining us today. My name is Sarah Barenko, and I'm the Director of Public Health here at Montgomery County. Today I have the pleasure of introducing Matt Phillips. He is an intern that's been working with us this summer from SUNY ESF, and he is going to be doing a presentation today on ticks and tick-borne disease. For those of you who are needing this for your municipality, for your job, we will be sending the PowerPoint and an attestation page to the municipalities that are in need of this. And if you have any questions, as always, you can feel free to call the Public Health Department at 518-853-3531. I will turn it over to Matt, and thank you again for joining us.
So there's a few ticks of major concern in New York, one of which being the American dog tick, seen here. There's a couple diseases that it can spread, including tularemia and Rocky Mountain spotted fever, and they're present during the spring and summer months. Another tick present in New York is the deer or black-legged tick. These can spread Lyme disease, anaplasmosis, ehrlichiosis, babesiosis, and Powassan virus disease. And these are generally present in the summer, spring, and fall. Despite its name, the Lone Star tick is also found in New York, and this can spread Heartland virus disease, tularemia, ehrlichiosis, bourbon virus disease, and southern tick-associated rash illness, or STARI. These are generally found during the early spring and the late fall. Now, these can easily be distinguished by the white dot that are found on their backs. So if you're going outside for an extended period of time, you're going to want to watch out in areas of tall grass or any sort of brushy areas, or even in wooded areas. Ticks like to hang on to the tips of blades of grass, twigs, and sticks in the hopes that a host can pass by and they could latch onto it. When on the host, ticks generally gravitate toward warm areas of the body like the armpits or behind the ears. So, did I miss it though? Okay. So if you're going outside for a prolonged period of time, there's a few steps you can take to avoid ticks, which includes treating your clothing and gear with permethrin or any EPA-regulated insect repellent. And after coming inside, it's recommended that you should check your body and your clothing for ticks. You should check in the hair, behind the ears, under the arms, around your waist, inside your belly button, in between the legs, and at the back of the knees. You can also tumble dry your clothes for 10 minutes, and that will kill any ticks that may be attached. And it's also recommended to shower soon after you come indoors, as this can help wash away any sort of ticks that may be on your body. So if you do find yourself to be bitten by a tick, you should take a fine-tipped pair of tweezers and grasp as close to the skin as possible. You should then pull upwards with a steady, even pressure, being careful not to twist or jerk it, as this will leave mouth parts stuck in the skin. When the tick is removed, you should wash your hands and the area bitten with soapy water or any sort of rubbing alcohol. And you should never crush a tick with your fingers. You should either dispose of it in rubbing alcohol, a sealed container, or wrap it tightly in tape, or just flush it down the toilet. So many common symptoms with tick-borne diseases, one of which being a rash. This can occur with Lyme disease, southern tick-associated rash illness, Rocky Mountain spotted fever, tularemia, and ehrlichiosis. So Lyme disease looks like an expanding bullseye around the site of the bite, and this should happen between 3 and 30 days of the bite. And with STARI, it looks much the same with the sort of expanding bullseye formation. In Rocky Mountain spotted fever, you're going to see small, flat, pink dots, usually around the ankles and the wrist, and sometimes it involves the palms, as seen here. And with tularemia, there's going to be a skin ulcer around the site of the bite, and this will usually occur under the arms or around the groin. And with ehrlichiosis, about 30% of patients exhibit a rash that is very similar to Rocky Mountain spotted fever. However, these dots can range in size. Some other common tick-borne symptoms would be fever and chills. This can occur across all tick-borne diseases. However, the fever can occur to varying degrees. Aches and pains can also occur, and this can include a headache, fatigue, and just general muscle aches. And Lyme disease can also occur, or can also present joint pain. Early recognition and treatment are key to reduce potential serious complications. If you were bitten by a tick and experience any of these symptoms, then you should contact your doctor immediately.